So, yan. Maraming salamat.
Doc, di ka po namin marinig, Doc.
Unmute.
Yan, Doc! Salta na po kayo, Doc.
Okay na?
Yes, Doc! Okay na po. Okay na po.
Yan. Okay, so, yan. So, congratulations dun sa mga presentations. So,
nawala ba siya ulit?
Nawala po ulit si Doc.
Baka pwede natin pakita yung criteria for judging, Chico.
Sige, natin. Oo.
So, si Doc Hoson ng...
Doc Hoson, kayo na po mag-present ng criteria for judging.
May next dyan. Next slide.
Next po. Ayan.
Ayan. Doc Hoson.
Okay. So, all the prospective presenters or yung magsasabit na mga papers were given beforehand this criteria for judging. No? Okay. So it's very clear that we will judge it based on criterion-based judging. No? Okay. So, but the judges decided to modify it a bit and give the necessary weights, but they still follow the criteria that I gave all the prospective participants. No? Andiyan na si Ans. Pwede na si Ans?
Dito na po si Sir Ans. Doc Ans? Medyo delayed pa rin po talaga kay Doc Ans, so I guess we can just proceed na lang po, Doc.
Okay. So, number 1, impact of the program, no, 20%. No healthcare worker dying from COVID-19, okay, 20%, no? So we don't put a lot of importance on the infected. Kasi siguradong may mag-i-infect talaga yan eh. But what's more important, walang mamamatay, no? Okay? So innovativeness, 15%. Community engagement, 15%. Sustainability of the program, which means that whether it can still be used in the future, okay, 15%, and then cost effectiveness, 50%. So that in fact is 100%. No?
Woo! Baga-baga 100%.
Grabe, ang hirap naman para manalo.
Malaki naman yung papanalunan.
Malaki naman, 75,000 yun. Dapat pag-ready na kayo ng eco bag nyo kasi tagpipiso talaga yun.
Kailangan matibay na eco bag.
Shall we announce na ba? Ano bang next natin? Or hindi pa, no? Bigyan naman ako ng cue na next.
Wala talaga si Doc Ans.
Wala talaga si Doc Ans eh. Oo. So, anong next natin?
Okay. So, Doc Hoson?
Hindi siya babalik? Hindi siya makakabalik?
Mukhang hindi na po. Yung connection po niya, hindi na po nakabalik, Doc.
Si Harry. I think she was referring to Harry Hamoy to take over. Si Harry, andiyan ba si Harry?
Wala rin po siya dito. Opo. Ay, si Harry? We can let Harry in na lang po.
Okay, while waiting, okay lang sa inyo if I just share with you some of my thoughts, no? Okay.
Sige, Doc.
Sige po.
How I started. Sabihin mo lang kung nandiyan na si Ants, na.
Sige, Doc. Sige, Doc.
So, earlier I was talking about the history of the project, no? Okay. So, but as early as March 19, no? Okay, I wrote this piece of a parang insight, no, in my Facebook. Okay. So, sabi ko, I am 71 years old now. I am a MSN. I am a health worker. In the midst of COVID-19, sabi ko, our Makati government has an order that senior citizens should stay home. Okay? And with the community quarantine, I'm also ordered to stay home because of my age. Okay, I'm not also allowed to volunteer in the emergency room because of my age. No? Kasi may mga hospitals telling us that because of your age, you cannot go to the emergency room to volunteer. No? So, but I said to myself, I wanted to be useful. I wanted to help in the fight against COVID-19. Okay? So, there and then, I thought of 2 contributions that I can give to the COVID-19 fight. Okay? One is online education for the public, especially my patients and followers in Facebook, because I have about 6,000 friends in Facebook, in the prevention and management of COVID-19. Okay? And my foremost advice at this moment, at this point in time, after considering all the past advices of DOH, WHO, okay? So my foremost advices for the public is that 1 is to stay home as much as possible. Go out only when extremely needed, okay? 2 is to avoid physical interaction with all people, even with your relatives. Consider them as potentially contaminated and infected with COVID-19. If you have to interact with them, always wear a face mask, yung sinabi ni Anne kanina, and have physical distancing of at least 3 feet. Number 3 is to do maximum personal hygiene, especially washing of hands as frequently as possible, and avoiding touching objects handed to you by somebody else, okay? Because that somebody might be carrying COVID. Okay? 4 is to optimize your in-host immune resistance or system through healthy lifestyle, healthy diet, exercise, stress management, etc., etc. Okay? Lastly, if you get sick, okay, do telemedical consultation. Do not rush to the doctor's clinic and hospitals unless it's really extremely needed. If it's a life and death situation, go ahead. Pero if you're not sure, do a telemedical consultation first. The doctors will advise you what to do. So stay safe from COVID-19. We always talk about stay safe and stay healthy. That's a common buzz phrase nowadays. Stay safe from COVID-19 infection, as it is not worth dying from it, because it is a preventable disease. No? Okay? When you say stay healthy, you stay healthy at all times, as you cannot afford to get sick. Kaya bawal magkasakit at this point in time, as it is too risky to go to the doctor's clinics and the hospital. It is also a hassle because of a lot of protocols that you have to go through. And it is very expensive to get sick during this COVID crisis. Okay? So yan ang advices ko. Andiyan na si Anne?
Anne, dito na po kami, Doc. One of the things that I recently heard, parang may isang patient na nag-positive and gumaling naman siya. Parang sabi niya, sana nag-mask na lang ako. Mas maliit yung effort ng pagmamask kaysa yung everyday akong nagpapagamot.
At mas mura,
mas mura pa. Mag-mask ka na lang, wag ka na lang talaga lumabas. And if lalabas ka, it should be really critical that you need to go. But as much as possible, follow the preventive measures and hindi ka na ma-hassle kasi mas hassle talaga magkasakit. I agree with Doc Hosan po. So, Rush?
Bale, hindi na raw makakapasok si Doc Ann. So, binigay na lang sa akin yung winners, yung results.
Nasa iyo na pala yung resulta.
Wala yung reactions niya? May slide siya on the reactions?
Wala, Doc eh.
Wala, Doc eh.
Hindi na, Doc eh.
Meron siyang reaction, Doc. Ang sinabi niyang reaction, ha! Ha! Ganun, Doc. Ganun.
Ayun, Doc.
Wow.
So, labas ang DTI representative natin. So, para sa ating winners, tulungan nyo naman ako mag-announce.
Yes! For the winners and special awards.
So,
yan, let me know.
Yan. Meron tayong special awards para sa ating ano ba sila? Ayan. Pang
Doc Ants,
fourth.
baka naririnig mo kami, Doc Ants.
Ayan, Doc Ants!
Doc Ants, sige na naman.
Yan. Okay na ba? Okay na ba?
Hey! Yes. Rinig na.
Okay, pag gusto mo paraan. Okay.
Okay, Doc Ants. The floor is yours.
So, Doc Ray, announce natin yung winners special awards.
Yes. Yung reactions mo na lang muna. Mas importante yun.
Okay, sige.
Sabay-sabay tayo mag-reaction! Ha?
Okay. Sige. So, ito. Congratulations dun sa 6 presenters. Pinakita nila lahat yung yung nagkaroon sila ng parang problem tree analysis. So that parang sinigurado na yung mga factors na nakaka-affect sa problema na sosolusyonan. So ang galing ng mga ginawa nila. Yung iba sa mga presenters, ang label nila doon yung root cause analysis. Pero basically ito yung tinuturo sa atin ng College of Public Health, College of Nursing, College of Home Economics na problem tree analysis. So galing. Tapos yung mga presenters, nagpakita sila ng belief sa tao. Yung nagpakita sila ng paniniwala sa likas na husay at sipag ng leaders, ng healthcare workers, at saka ng general public. So, wala dun sa mga presenters ang nag-resort dun sa papahiyain ng tao, shaming, ganyan. So, very good. Ang galing dun sa paniniwala nila sa tao. And then, all the presenters also showed, intersectoral collaboration. Kasi nga lumabas sa analysis nila na maraming factors ang nakaka-apekto sa problema. So lahat sila nagpakita ng intersectoral collaboration. And then yung general guidelines ng government, lahat yon pinatupad nila. So ina-activate nila yung birds, meron silang process flow. Like yung pagpapagawa ng process flow, napakahalaga nun kasi parang for the benefit of both the health worker and the patients and the communities, maganda may leveling off. Tapos yung mga polisiya sa contact tracing, sa barangay isolation units, yung mga engineering at saka administrative measures, ang galing. So, yon, ang galing ng mga municipalities saka ng mga hospitals. And then of course, they all showed their dedication to the protection of the healthcare workers. And of course, dahil nga sa innate nature nung tong problema, lahat sila nagpakita ng paggamit ng mga remote strategies, yung mga online ways of engaging each other. Pero ang isa siguro talagang pinakamalaki sa pwede nating sabihin sa lahat na sana tularan nyo tong 6 na to is yung nila, parang pagkilala nila sa basic husay at sipag ng mga tao. So nakakatuwa na hindi sila nananakot, hindi sila nang papahiya ng anyone, meron silang belief na kaya to ng tao, tapos yon, naglunsad sila ng mga projects. At yung mga projects, napatunayan naman nila na talaga, patok talaga yung mga proyekto. So, congratulations. At yun ang reaction, sana lahat ng mga LGUs, maliban naman sa kanilang 6, marami ng LGUs at marami ding mga hospitals ang ganyan ang ginagawa. So sana itong ganitong klaseng approach, yung intersectoral collaboration na kung saan, kunyari, yung ating mga PNP at AFP, kasama rin sila dun sa team. Kaya parang, pero ang namumuno, talaga, yung local chief executive at saka yung health sector. So mas maganda sana yung ganong dating na composition ng team. So ang galing. So ito, yun yung reaction sa mga LGUs at hospitals na nag-present. Yan. Maraming ganyan Right now, maraming LGUs at hospitals ang ganyang kagaganda ang strategy. So sana lalo pang dumami. Okay.
All right. Thank you for the insights and inputs, Doc Anthony. Yun. Thank you.
Yun. Sabang reaction, Chico. Sabang reaction.
Isa pa.
Maganda.
Maganda. O paano? Announce ba natin? Kung sino ating winners and special awards? Drum roll sa aking stick of box.
Sige, so unahin natin sa special awards.
Aray, nahulog tuloy. Yoko na.
Yan.
Okay, special awards. Let me know if gusto niyo na
Special awards!
Goes to... Next slide, please.
Yay!
Kay Dr. Brent, kay Dr. Ami, at kay Dr. J. So, they will all be receiving 15,000 pesos each and a certificate. So, mabuhay kay Dr. Brent, Dr. Ami, and Dr. J.
15,000 each!
For screen share. Ayan, pwede nyo po screenshot yan. Screenshot nyo na po. Alright, next.
So,
second runner-up.
Next natin ay yung second runner-up at ito ay drum roll ulit. Game.
Next slide.
Next slide.
Second runner-up goes to... Ay,
Sino?
Hey!
Okay, so...
Congratulations,
Doc! Di na lupi ang batangan. Nanalo ng ating second runner-up, 25,000 pesos and a certificate. Yan. Yan ang ating bronze medal winner. Congratulations, Doc Jonah.
Teka, dapat yung first runner-up saka yung grand winner nag-holding hands na yan.
Oo, yan. Nag-holding hands. At sa ganung logic, pag in-announce natin yung first runner-up, di malalaman na rin kung sino yung...
Oo, sir. Matik na yan. So I guess, without further ado,
okay.
First runner-up.
First runner-up. Next slide, please. Doc Sandra mula sa Tinglayan, Kalinga. At ang ating first runner-up ay makakatanggap ng 50,000 pesos at certificate.
And of course, since alam naman natin, nawala na, nakuha na yung first.
Sino ba yung
winner? Ang winner automatically goes to Chika!
Chika Crema from Polanco. So,
na mananalo po
75,000 pesos and a certificate.
At mananalo din po kayo ng Golden Pinya. Wala po sa HelpThru. Ayan, so congratulations, Doc Kima.
Invite naman si Doc Chika.
Ay, syempre. Ay, di na siya Doc VJ na yan. Doc VJ Chika. Doc. Congrats, Doc.
Salamat po, Doc Ash.
Naririnig ko yung sarili ko kayo sa cellphone yan.
Sorry, akin yan.
Di na siya Doc VJ. Oh, tignan mo. Sabi sa'yo, rinig ko boss ko eh. Alright, Doc Chika, any words na gusto nyo i-shoutout, pasalamat sa family mo, Kuya Well?
Baka maingat po ako.
The floor is yours. The floor is yours.
Syempre po, thank you so much to the local government unit of Polanco for being very responsive. Thank you to all the health workers, to the frontliners here in Polanco. Kasi dahil po sa inyo, kaya nagiging contained yung virus sa ating lugar. Shout out na lang dun sa aking family. Hi, mommy, daddy, and sa aking mga kapatid. At sa aking special someone.
Ay!
Thank you.
Nako, yung mga umaasa, sorry tikin na pala si Doc. Nako.
Pangalan ng special someone.
Pwede.
Huwag din pressure. Mahirap na.
Pressure si Doc.
Thank you also so much to HelpThru, to Reilief, to Graduate. Napakalaking tulong po talaga. You inspire us, all health workers and frontliners, to do our best.
Yes, especially Doc, kayo po. Alright, congrats, Doc!
Okay, tawagin na natin kung partly kanino nang galing yung mga
group picture
natin.
daw. Group picture daw with Doc Kima. Dali, group picture. Sino mag-screenshot? Sino mag-screenshot ito kayo?
Ikaw
pwede,
na.
Nag-ooperate ako. Di pwede, kayo to. Dali, kayo na. Ay, ako na nga. Sige, game. 1, 2. Okay. Doc Kiva, thank you po ulit.
Thank you.
Allergy po yan, di po yung COVID. Wait lang po. Allergy lang. Bye-bye. Alright.
Okay. So, tawagin na natin ang ating next. Malapit na.
Ay, si Doc